Oh my gosh, Careblazer, I am so excited to share with you today's video. In this video, I interview Dr. Michael Yasinski. He is a psychiatrist and he works a lot with the geriatric population, including doing home visits. So in this video, he shares 5 things he covers with all of his patients. Older patients with suspected cognitive impairment or with dementia. These are 5 very important things he thinks every doctor should be reviewing with their patients. And if you watch this video and you find that maybe your loved one's doctor hasn't been focusing on some of these or hasn't been asking about some of these, you can bring up these with your doctor. Now, Careblazer, please be sure to let Dr. Yasinski know how much you appreciate him offering his expertise to all of us today. Go ahead and leave a comment below the video. Do a thumbs up. My hope is that we'll be able to get him back on the show again in the future. He had so much knowledge to share. Also, Careblazer, I want to let you know real quick, today is the opening day of my care course. If you are feeling overwhelmed, stressed, at the end of your rope, this is the time to join my care course. I'll walk you through my 3-step system to help you lower that caregiver stress and help you be ready and prepared for all of the difficult challenges that come along this caregiving journey. I truly hope to see you inside the course area. There is a link below this video that you can click on so that you can learn more about the course, about what it is and how it can help you. All right, let's get to this interview. Dr. Yasinski, thank you so much for spending time with us today to share some very important information with our Careblazers. So before we get started, can you just give us a little bit of background about yourself?
Yeah, so I'm a psychiatrist. I specialize and see a lot of geriatric patients, which includes families dealing with dementia primarily. I also do house calls, and I really take an integrative approach. So I try and look at the whole picture and try to get to the bottom of what's going on and really help families.
That's awesome. Okay, so today we're going to talk about 5 important things that a good provider dealing with the geriatric population should be looking at if somebody who has suspected dementia or has dementia is coming in for a appointment. Like 5 things the doctor should be talking about.
Exactly.
All right, awesome. So give us the first one.
All right, so when I go in to see someone, often it's a house call, so I'll get the opportunity to go into their house. That isn't always the case, so if you're not having your doctor come in, I put it upon people to do these 5 things, so they have to take some ownership and take charge as well. So when I go into a house, I think the first thing I'll start with is I'll get people to pull out their medication box or their bag.
Yes, okay.
So let's talk about that, and I'll go through some tips on
Okay.
what to do with medication.
Perfect.
So here's what I often see.
Okay.
People come out with medication.
That usually happens a lot when they come to the office, so yeah.
So that's good. So first tip is if you're not having your doctor come into your house and asking for this, or if you're going to your doctor, bring all your medications. No list. So don't write them down. Don't assume that your list is accurate. Don't bring a printout of your last visit to your doctor or hospital. Take everything you put in your mouth, put it in a bag, and take it into your doctor. So then your doctor should take out your medication. So this is what I do. So we'll get everything out, including over-the-counter medications. That's important. So don't assume your doctor is not interested in over-the-counter medications. Get out your supplements, which we'll talk about more in a minute. So get everything out. Get all the bottles, etc. Vitamins. So let's say we got everything out here. Now, when I look at a person's medications, there's a couple tips I'll give you that I really look for. One is duplicate medication. So go through each medication, take out your list if you have it to compare so you can get an accurate list, and start making sure, number 1, you don't have duplicate medications. One reason for duplicates is because your dose was changed recently. And so you still have your old dose and you have your new dose, but you have them both in your bag. And somehow, maybe it was getting into your pill box wrong if you use one, or it was labeled wrong. You're taking 2 of the same medication, and that could be causing all sorts of symptoms like mimicking dementia, cognitive problems, worsening your memory, worsening your mood, etc. So look for duplicates. The other thing I would say, there's a couple medications that stand out. One I'll mention, if you're having or on any medication for bladder spasms or incontinence, that type of medication, as an example, can cause drastic effects on cognition and memory and can mimic symptoms of dementia. So take that in if you're not already diagnosed, or if you have a diagnosis, and look for alternatives with your doctor. Have that conversation. So certain types of medications, make sure you're not on something that's worsening your problems.
Right, and that's why it's so important that they're bringing all their medications, because the doctor would know what kind of medications would make cognition worse.
And look them up yourself. Be vigilant and look them up online. That's one piece of information. You don't want to replace that with what your doctor says, but empower yourself. The third piece I think is necessary to talk about is interaction. So look at the medications. Online, you can look for medication interaction checkers and talk to your doctor and look them up so you have some idea. Sometimes the different medicines interact in a way that cause you problems, or they don't allow the medication to work, and that causes other problems. So my point is, it starts to be one big element of why you might be having problems, or your problems may look worse than they actually are, because of a very simple fix and a completely reversible fix with medication, so you don't go down the path of getting the wrong diagnoses, getting the wrong treatment, etc. And the fourth thing I'll touch on is the medications for dementia themselves often don't work with certain medications that you're already prescribed, and if your doctor doesn't know about them or they're not on your list again, they really will be under-equipped to be helping you with trying to maximize the medications that are available to help you if you have a diagnosis of dementia. So medications, put them in a bag, bring them into your doctor.
Awesome. I love it. So much good stuff, but I think it's really important because trusting a list, like a lot of people come in with just a list. But it might not be updated. When was the last time it was updated? Is the dosage right? So having a provider who's actually interested in looking at all of those medications is really important, including over-the-counter and supplements that aren't prescription. Those can have, those can impact.
Exactly.
Right.
Yep.
And then I like where you're telling people to be their own advocate and look some of this stuff up. I've talked before in the past about like the Beers criteria. And like for basically medications with anticholinergic
The anticholinergic effects.
Right. So it's like, the American Geriatric Society, that's the biggest one. Right. We've talked about
nobody
this.
should be taking Benadryl without at least your doctor who is knowingly interested in you telling you that you need to take this. But I've never seen anyone that has any element of memory, cognition, or dementia symptoms be taking Benadryl or equivalent over-the-counter sleep medications. Right. This is just an example, but any over-the-counter medication for sleep or allergies, never.
Yeah, anything with like the PM, I say, be very careful. That diphenhydramine,
right?
Just that Tylenol PM. You're hoping your loved one will go to sleep, or you're hoping your loved one's allergies will get better, and all of a sudden they're starting to look a lot worse.
Exactly.
So just because it's over the counter, it's not.
I can't tell you how many people I've seen. 2 questions I go in: are you taking medicine for bladder incontinence? Are you taking over-the-counter allergy medications? So many people. Again, those anticholinergic effects, which really do the opposite to the brain of what we want to be happening. It exacerbates the existing problem in your brain that's already happening if you're dealing with cognition issues or memory loss or dementia.
Totally, and that's why it's so important to have a provider who is familiar in working with the geriatric population and looking at the whole picture, because if you're just going to somebody for bladder, of course you're going to get a medication to help with bladder, right? But if they don't have the whole picture, they might not realize that's not the best medication for this person. We need to look at something else.
And the communication, although I'm sure as people find there's more electronic portals, everyone has electronic medical records, those records don't talk to each other.
Right.
And since everything's electronic, doctors actually don't or rarely talk to each other anymore. So there is no line of communication. And so every doctor is interested in their specialty, and it's not that they're disinterested per se, it's just they often don't address these other things and don't know you might be taking an allergy medication or this or that. There's no communication and integration. So your doctor should be interested in all of the information, which includes all of these medications, over the counter and prescription.
Yeah, and that's why information like this is so important for the caregivers to have so that they can know what they need to know when they're going in to see a doctor. So I love
Definitely.
it. That's great. Okay, anything else on the medication piece before we move to the second one?
I think that covers it. Yeah.
Okay, that's good. So what would be the second thing that a good provider dealing with the geriatric population should be looking at?
So let's keep the bag out here.
Okay.
All right. And so even more importantly, so we'll take up all the supplements. Okay, these are not medication prescribed, not over-the-counter medication, but supplements.
Yes.
They're all natural, so they should be the more the better.
Right.
Is the thought,
right.
Oftentimes.
I've seen a lot of patients come in with like 20, 25. We had one person with the prescribed medication and supplements and over-the-counter medication, like totaling up into the 50s.
It's too many sometimes. And as doctors, we aren't honestly trained to often ask about supplements or talk about them. And there's this assumption that, they're just not important. And again, if your doctor's not asking about them, that's not a good sign, because just because they're technically over the counter, you don't need a prescription, they're all natural, etc. These have potent effects on the brain, and they also interact with medications and cause all sorts of problems. So I'll tell you a short story of a lady dealing with dementia who was really struggling with anemia. Her blood count was low, she was weak, she was at risk for falls. Falls are terrible.
Right.
She was having a miserable time, wasn't doing well. And this is one example. She had added herself turmeric or turmeric.
That's
two
a popular
pronunciations.
one.
Very popular. There's even two ways to say it. And it's great. It helps with inflammation. It helps with mood. It helps with cognition. How scary is that? It helps with cognition.
Right.
Great. Let's go run out and get turmeric.
Right.
This can almost eliminate your body's ability to absorb iron. Iron, especially as you get older, people maybe eat less food with iron. They're more frail. They get anemia. Iron is what helps you create red blood cells. And so you need those red blood cells to stay oxygenated, have normal energy levels. Just this one simple supplement can eliminate your body's ability to absorb that. So I've seen in this lady, she was taking high doses of iron supplements, and her doctor was giving them to her. Didn't ask her about the supplements. Iron is so hard on the stomach and causes other problems, supplemental iron. And she wasn't someone her appetite wasn't good. She didn't feel well, so she wasn't even eating either. It was really getting her. And ultimately, checking the levels, it wasn't, the iron supplements weren't helping. But she didn't tell anyone that she was on a supplement. And this is just one.
Yeah, who would think turmeric was going to, impact the iron?
Because supplements don't have normal levels of micronutrients in them and things like what's in turmeric. That the doses in here is not what's in a naturally occurring nice turmeric root you would get and make some nice turmeric root tea.
Right.
This is very concentrated. So this is just one example of where if you're on supplements and your doctor is not asking about them, you need to be talking about them. Magnesium's another one, very common for people to take, very good in some cases. But, the wrong forms can cause you to have a lot of diarrhea, and then that can throw off your electrolytes. That's just one example of an exacerbation of your underlying metabolic state and your electrolyte status, and can make you more confused.
Yeah, and dehydrated.
Make you more dehydrated, right? So then you go into your doctor, maybe they're having you do a mini mental status exam every time.
Yeah.
Maybe you score worse. But geez, I didn't know I was a little more dehydrated because I was taking magnesium to help me sleep.
Right.
Who wouldn't? But if you don't know unless you have the discussion, and honestly, even if they're interested in talking about it, sometimes they're not aware. I'm not aware of every problem that occurs with supplements, and I do this very diligently. So look them up yourself, have a good idea of what you're taking, talk about them, and bring all of them in, no matter how irrelevant or unrelated you think they may be, and present them all, how much you're taking, bring in the bottles. And again, just give your doctor the opportunity to maximize your chance of helping you and maximize your chance of not having problems.
Yes, that's so important. I think the key thing here is no matter how irrelevant you think the medication might be. Like, who is going to think turmeric is that big of a deal to tell your doctor? Well, apparently it is a big deal. So
It's a huge deal.
Anything, any supplement or pill your loved one is taking is something to be bringing up. So
Yep,
I love that. Thank you.
And let's go with number 3. So let's put this away.
Yeah. All right, so it's the third
Let's go
thing.
with number 3.
All right, let's hear it.
So these are all seemingly very simple, but so important. So let's go with hydration.
Okay.
So I like to bring a visual representation of hydration. So this is what I do for my patients. We're going to lay out how much somebody should be drinking every day. At least 6 bottles.
Mm-hmm.
So I'm Canadian. I would say this is 3 liters.
Okay.
But just under a gallon a day. But I think people do better with visual representation. So
Yes.
I have caregivers put in the fridge each day, depending on where you're at. Sometimes, they're taking care of someone that they're in charge of their food, their medications, their hydration, so it would be up to the caregiver. And so I put these, make it easy in the fridge, put 6 of these in a day, and you know exactly what your loved one's been drinking.
Mm-hmm.
I'm sure there's snazzier, fancier ways to track this stuff, but sometimes people like something simple.
Right.
And this is very easy for someone to walk around, or if they have a cup they like, that's fine. They can dump it into there, and they can walk around with their cup with a straw.
Right.
But at least you're aware how many they're drinking. And as a doctor, I track this stuff. So I'll ask them, I want you to do this, and when I come back in 2 weeks or a month, I want you to tell me if they've consistently been drinking. And how they can track that is they'll know if the bottles are gone consistently each day. That's a pretty good way to know how much they're drinking, because otherwise it's very hard if you ask someone, how much water are you drinking?
Yeah.
Well, I don't know.
Right.
Like a good amount.
Right. I mean, that's my answer, a lot.
It's like a lot to you might be different than to me. And what is a lot?
Exactly.
And this is a good amount to, like, a good gauge.
Yes.
And so a couple things. I've literally had people that thought they were in a late stage of dementia realize they simply weren't hydrated, and they've improved so drastically because really when they looked objectively, they were drinking 1 of these.
Right.
And your body can't survive on one water.
Yeah.
I wouldn't be able to function.
Right.
When you're compromised, you're a little bit older, you're struggling with dementia, your brain is taxed, your body's being more taxed. You need maximum, basic needs, which is hydration.
Yeah.
So this does a couple of other things. Also, one of the most common issues, as you know, are things like urinary tract infections. So when you get dehydrated, maybe you're more at risk to get a urinary tract infection, especially if you're an older female, even in males. And when you have dementia, or just older, and you get any type of infection, but a urinary infection is so common, again, you can look like you have severe dementia.
Right.
When you might have very mild dementia, or you might not even have dementia.
Mm-hmm.
And all of a sudden, you could be put on a medication for dementia, might be hospitalized, when it's just you haven't been hydrated, which led to another problem, which is an infection.
Yeah.
Or another example, I believe if not the most common, one of the most common problems is falls, right?
Yeah.
So without enough water in your body, your blood pressure could be too low, especially when you go from sitting to standing.
Mm-hmm.
Just like that.
Right.
If I didn't have enough water in my body, I would get very dizzy.
Right.
And if you get dizzy and fall, the chance of you recovering from that after a certain age is very slim. So this is life-saving stuff that your doctor should be talking to you about.
Right. And I feel like it's something so basic that either it just doesn't get talked about, or even family members might not think it's, yeah, but tell me what's really going to help. And it's like,
Yeah.
this is the foundation. This is the building block. Without this, it's really hard to build up on anything else. Like, it's so important.
Yeah, that's a good point. I think convincing family of the importance, because at the end of the day, this is what I have to offer.
Yeah.
Like, this is exactly what I come in and this is what I'm paid to do, is this.
Yeah.
And as simplistic as it sounds, it's not getting done.
Right. And it can really benefit the family, because just think of the stress and the turmoil and everything that goes into potentially getting a UTI, becoming more confused, going into the hospital, maybe having some psychosis, all those things. That's so hard for the family members, and to think that water could help prevent all that. So it's just so important, and it's so basic that I feel like the basic things are the things people just kind of don't think are really that important, and they're the most important.
No, I agree. So hydration, extremely important.
Yeah. So
anything else on hydration?
Yeah. So what I'm already hearing people say is that my loved one does not like water. They don't drink water. They don't like the taste of water. What do you say to flavoring the water with certain things? Like, sometimes patients might tell me, I drink iced tea all day. It has water, or coffee has water in it.
Right.
You know? So can you just talk a little bit about how that isn't the same thing? And see, he's even drinking water.
You always have to drink water.
How it's not really the same thing, and if you want to say anything about adding things for the flavor.
If you can't just drink water, then put some flavoring in, and find something that's sugar-free, doesn't have caffeine, has minimal ingredients, but if you need some flavor and that's what's going to get you hydrated, I'm less concerned about, if it needs to be Kool-Aid, if people still drink that anymore, Crystal Light. But you have to watch those Crystal Lights, is because a lot of them have energy written on it.
Yeah.
And energy, whether it's caffeine or one of the 300 names that people try to call caffeine, or some derivative of caffeine, anything with the words energy on it, stay clear. Anything with extra B vitamins, again, just stay clear, because you're going to be consuming too many just to stay hydrated. You don't want to be consuming too many B vitamins. What else is in there that you've seen? I'm not so concerned with the artificial sweeteners. If it's going to be the means to get you hydrated, fine. But really, like caffeine or stimulants or anything like that, because that works against the hydration. For one, it's called a diuretic, makes you dehydrated, so we don't want that. Coffee and tea, again, that's not going to make up. That's in addition to the 6 waters. So good point. So if you put one of these in an iced tea and one of these in a coffee, that doesn't count.
Right.
We're talking 6 in addition to a coffee or iced tea or soda or whatever else people are drinking.
Awesome.
That's a really good point.
Yeah. Okay.
All right.
This is your goal for your loved ones every day.
Life-saving.
And for you. Right.
Yeah,
Totally.
everyone on has to be on board.
Yep, absolutely.
Yep, exactly.
So, okay.
All right.
That's so good. Okay, so we've just covered the 3. We've got 2 more to go. What would you say is the 4th important thing that a good healthcare provider should be asking about?
So, I think the 2 I personally do. I think these 3 are life-saving.
These are the top 3. Okay.
These are the top 3. The next 2 are almost on the next level of, if you want to take it to the next level, which I consider it basic. It just depends on how detailed someone wants to get. So in person, I go through nutrition. Okay. That's in the top. We'll put that as another top one. Has to be in there. So the couple takeaways. I really get someone to, again, bring in a list of what they're putting in their body, at least for a good week's representation of what a week looks like nutrition-wise. Because, again, our short-term recall memory is terrible, especially if we have early dementia or cognition. Right. Or if you're a caregiver and you're stressed and you're trying to deal with just getting my medications for my loved one. Or let's say it's my wife, I'm like trying to take care of her medications. Is she sleeping? Is she falling? Is she bathing? I got to get her doctor's appointments. I don't know what I'm like. I couldn't tell you. Am I eating 4 ounces of protein 3 times a day? I mean,
right.
What kind of size are you eating? I'm eating. Like, they
Right.
can tell me they're eating. That's not enough. I need to know what they're eating. So what that starts with is a weight. So what I recommend is you have a chart of your weight. At least that gives some idea that you're not losing too much weight, which is a real concern in someone with dementia. If you're gaining a lot of weight, then that could be some other concerns too. But I'm really interested in someone losing weight, because once you stop getting enough nutrition and you're losing weight, you're more, again, at risk for falls, medical problems, all the stuff we talked about, electrolyte problems, everything that is going to make how you feel 10 times worse and put you at risk for developing confusion on top of your existing problem, more confusion, ending up in the hospital, etc. So start with a good weight log. Bring in a weight log to your doctor. I think you can do that every day, is just get a good weight until you have things stabilized. Next, I really look at least a 7-day chart of what you're eating. So your doctor has some idea of what you're getting. And the things I look at, just to name a couple of them, protein is almost always not being consumed in high enough amounts. I notice this when people get older, eating almost becomes more cumbersome.
Yeah.
Chewing becomes more cumbersome. You might have problems with your teeth, right? You just might not want to eat. And anything that involves chewing, which a lot of protein is chewing, it's meat, right? Mm-hmm. A lot of people eat meat, unless they're vegetarian, then there's obviously some easier choices. Mm-hmm. But a lot of people still eat meat as their primary source of protein, or cheese, or things that aren't super easy to chew, frankly. So almost invariably their protein count or their amount of protein they're getting is low. Now, there's not a set number. I always at least shoot for 80 grams to kind of 120 grams, no matter what the size, that would be a really good intake of protein. Mm-hmm. I don't personally think the lower end, like the 30, 40, which you might find in the standard American food pyramid recommendations, is adequate. But as long as your doctor's having the conversation, I think that's a good start. But I aim for 80 grams as a minimum of protein to keep you healthy. I just think I've seen people do so much better when they're getting enough protein. The second thing that I aim for is just getting rid of all basic sugars. That's above and beyond, but the people feel so much better when they can make some subtle changes. And that's usually the next piece that is manageable for people, because I like to make things manageable. Mm-hmm. You can make a lot of good changes in your diet, but you're dealing with a lot of different things already. So I try to stick with a couple, and that's hitting your protein goal, getting rid of sugars, just added sugars. Mm-hmm. Stick to vegetables, fruits, stuff that has natural sugar, fine. But just get rid of the crap, the processed sugar, right, all that kind of stuff. Mm-hmm. That would be a great goal if you can just do a couple things. And then keep an eye on your weight, because that'll tell us, are you getting enough calories? And then if you're consistently losing weight, or there's something off with your weight, your doctor can have a more specific discussion why you're losing weight, what you need more of. Do we have to check some other lab values, some vitamin levels, nutrient levels? How are your vitamin B12, your iron? Are you absorbing things properly? But if you're maintaining a steady weight and hitting your protein goal, that's a pretty good indicator that you're roughly where you need to be, and that you're not compromising your body, which is what I'm concerned about. Are we putting additional stress on your body and brain when you're already trying to kind of do the best with what you have, keep your cognition as high as you can, keep how you feel as healthy as possible? Because the goal at the end of the day is you also want to feel your best.
Right.
I mean, that's how all of this, as well as, it sounds technical, but a lot of it's just, are you feeling well?
Right.
Are you happy? Are you not depressed? Are you enjoying life? Are you able to do what you want to do? Mm-hmm. So that's kind of my basic approach on exactly what I would have. This is the conversation I would have as a starting point with every patient. And I've gone as far as, if you find someone who really wants to work with you on nutrition, you can get, blood glucose monitors. You can start to aim for bringing your average blood glucose down a couple points and really work with, do you feel better? Do you just cutting out more specific things out of your diet if you want to play around with it? But you need someone who's interested in having those conversations. So if your doctor is not interested in even having the conversation, find an additional provider or maybe a naturopath or functional medicine doctor or someone that wants to talk about those things, because I think they're very important.
Absolutely. And I think a lot of the focus is on what can we do to make the thinking better, and it's like medication or, just that focus on that part. But it's like all of these basic things are going to make the cognition better too, are going to make your loved one function better day to day. It's going to make your life easier caring for your loved one. So I love it. And I love the point that, if your doctor's not bringing it up, you can certainly bring it up. Say, hey, I was thinking nutrition is really important. This is what, my loved one's eating. This is what's going on. What do you think? And if they don't seem interested, that's where you go find somebody who cares.
You have to be your own advocate.
Absolutely.
I've learned that going through my own medical problems, even as a physician, it's hard to be your own advocate. I've learned it's so necessary. So get different opinions, see experts in nutrition, because I also don't expect every doctor to know everything about everything.
Right.
But they should be open to the conversation and then helping you find put the pieces in place. You need a quarterback, so to speak, to help put the pieces in place if they don't know how to help you directly themselves.
Absolutely. A referral to a nutritionist perhaps or something like that.
So, exactly.
Yeah. Awesome. Wonderful. All right. Do you have one more for us?
I think it has to be exercise.
Oh, okay. I love this one.
Are you a fan?
Yes.
Okay. So what are your thoughts?
I think it's so important. I think it's important not only for the physical reasons, but I think just for the emotional reasons as well. And you have to move your body at whatever functional ability you have. Like you don't need to go run a mile. And it could start with just being seated. So, I mean, there's like, it's so basic, I have this probably a cynical joke in my head a lot, where it's like whenever a groundbreaking research comes out, or it's like this really great thing that helps you lose weight, or this, it's always like, let me guess, it's diet and exercise, right? But nobody wants to hear it, But so go ahead, I'll let you talk.
No, I agree. There's just so many elements to talk about.
Yeah.
Ideally, I think the two missing pieces, and again, it depends on where you guys are at with things. And so sometimes I talk in ideals. At the end of the day, it's what's doable.
Right.
But I think it's good to have a baseline of what's the ideal situation, so you can at least know what to shoot for or aim for. So, I think an element of putting on or maintaining muscle mass is so important as you get older, because lean muscle tissue not only provides stability and strength to your movement, so you can stay mobile, because I agree 100%, being able to move, but you need muscle to do that safely and effectively. Muscle tissue also plays a big role in the metabolic stability of your body, like processing the foods that come in, your blood sugar, the way your body deals with nutrition. If you don't have muscle mass, there's a lot of fluctuation in what your body's doing. It's going to not make you feel well. So a strength component, if, with some resistance training in addition to the movement, is great. So I always start resistance training, muscle mass, sometimes a personal trainer if someone's able to get that, or if they have knowledge already. Not to neglect that, because a lot of people think as they get older, I just need walking's fine or moving's fine. That's all necessary, but not sufficient in my opinion. So something to do with resistance training if possible, in a very safe way. Don't go lifting very heavy things unsupervised, but something in a safe, controlled way with some help, or train the proper way. And then, like you said, just movement.
Yeah.
Walking's a great place to start.
Yeah.
Everyone who's able to should be able to walk, and if you're not able to, you probably need to see a physical therapist or someone to assess why you're not able to walk, and get you to the point you can walk. Right. So every one of my patients should be walking. The goal is at least half an hour a day. If they want to do more, great. But that's always what I set as the goal, is a half-hour walk. It's also a great way to spend time with your loved one, doing something together, getting out of the house. Right. So oftentimes people are just stuck in the house because it gets hard, gets difficult, depending on what type of dementia or the problems you're experiencing. You know, maybe it's hard to be around people, so you don't go out into public that much anymore.
Right.
At least you can get outside and go for a walk.
Yeah.
So 30 minutes of walking, something to do with strength training of some kind, and I think those are probably the two keys, because again, also prevents falls. Again, if you fall, it's not a good spot. Beginning of the end.
Right.
And people don't want to hear that, but it's reality.
It is, yeah.
So yeah, those are my thoughts. What else on exercise?
Absolutely.
Anything else you think of?
Well, the thing that's coming to mind is it's so easy to lose that muscle mass and so easy to just become debilitated. Like, I'm always reminded when some of my patients will end up in the hospital and maybe they're just there for a week, but then they have to go to rehab and they have to get because like it's so easy for the body to lose all that. So being able to maintain is so important, because 1 week of just like
goes so quickly.
Right. And it just
Yeah, so I think, as everything, maintaining is so much doing it from the get-go.
Yes, that's a good thing. Like, especially if you're watching and your loved one is in the mild stage or early stage, it's like, these are the things you can set up now. Like, I wish everybody could get this right away when their loved one is diagnosed to kind of set up, because it's also nice you can start your daily routine, which is really great for somebody with dementia. Like, we're going to walk at this time and we're going to, and at some point, everybody's going to decline. But trying to maximize their functioning as long as possible is so important. And I don't think these messages, as basic as they are, actually get out.
And for the caregivers too.
Yes.
They're in for a long haul potentially too.
Right.
They're doing active stuff. They have to be feeling good.
Yeah.
Be staying healthy.
Yeah.
All of this contributes to sleep. They have to be sleeping well. That's a whole nother
yeah.
topic, but
that's actually probably a really good topic in the future. But what I love about like all 5 of these important things is they all apply to every human being,
Yep.
So like as the caregiver listening, like trying to figure out what to do to help their loved one, like take this information in for themselves too is really important.
Yeah, for sure.
Totally. Awesome. Anything else you'd like to add before we end today?
No, I think that's what I do every time this is exactly what would happen when I come and see a patient for the first time, and every subsequent visit is exactly what we went over today. So, that's how you know if you're getting good care, in my opinion, is your doctor should be doing these 5 things.
Awesome. It's very clear your patients are lucky to have you, have somebody looking at everything that's going on, the big picture. I love it. Do you want to send anybody to a place or a website or anything to learn more about you if they want?
Yeah, you can go to MSYpsych.com, and they can learn more.
Awesome. I will link that website below in the description so you can click on it and learn more about the doctor. All right, Careblazers, I'll be back next week. Bye. All right, Careblazer, what did you think? I thought it was so good. Let us know what you think by leaving a comment below. Let us know if you have any follow-up questions for Dr. Yasinski. Maybe we can get him on the show again. And don't forget to check out the link below to his website and also to the CARE course so you can learn more about it. I'll be back next week, as always, with a new video. In the meantime, Careblazer, keep up the good work.